Hey everyone, I normally don't do videos like this, but I just have gotten so many texts and calls from athletes and colleagues, teams and organizations. I just felt like I should probably come on and just say something. I think first and foremost, I just am really happy that TJ is going to be okay. I do not know him. I have never worked with him, but I think the fact that a human is attached or was attached to the other side of this needle is getting a little bit lost in the social media conversation. So I just want to say that it sounds like I'm glad he's going to be okay, and that is first and absolutely foremost. Second, I just want to say that I have no knowledge of what happened in the facility. I don't know anything about the technique that was performed, and I have no details about the situation. So anything I talk about is going to be from a very, very general perspective. Third, I do not want to have the conversation about acupuncture versus dry needling. I think the amount of finger pointing that is occurring on social media is insanity. Let's not throw stones in glass houses, as they say. There are plenty of documented case studies within the scientific literature that associates both acupuncture and dry needling with pneumothoraces. So let's not point fingers and act as though this adverse event is not possible with acupuncture. It absolutely is. It's been reported in the literature, and that's just not a productive conversation at this point. I think what we have an opportunity here to really talk about is standard of care, informed consent, patient selection, and safety as it is related to not just needling, but really any medical procedure that we do. And really everything that we do in life is associated with risk versus reward. You know, I get into the car to go to the grocery store, and the reward of getting food outweighs the risk of getting into a car accident on the way. And so everything we do has an element of risk and reward, and medical procedures are no different. I think we can mitigate those risks by selecting the proper patient for a technique, specifically as we're talking here about needling. And I'm just going to say the word needling to avoid acupuncture versus dry needling. Let's just talk about needling in general, the use of a fine filiform needle to stimulate some type of neuromuscular stimulation within the body. I think that's what we're talking about here. So we have to have proper patient selection. That's absolutely key. And yes, I have also read the studies about needling being equivocal to other interventions. So some people are saying, why would we select an invasive intervention when other things are shown to be just as good sometimes for certain pathologies? And I think we have to remember that there's also evidence to show that the patient's belief system and my belief system as a clinician both impact patient outcomes. And so if people have a positive outcome associated with the treatment, and plenty of athletes that I work with have had very positive experiences with needling of all types. And so they believe that this intervention is going to be very positive for them, depending on what's going on. And so we just have to have proper patient selection. Every technique is not for every patient. So I think selecting the right patient is number one. Number two, we really have to have a great understanding of our anatomy. And this is the reason I host a a dissection class every single year. Anatomy to me is so important. And being in the lab and looking at the anatomy and how it varies from person to person is such a huge part of my personal practice, and is just so important to me. And how everybody's anatomy is different and how we apply different techniques based on the patient's anatomy is really, really important. Third, I think all needling techniques are not created equal. Some techniques are more aggressive than others. And if we decide to do a needling intervention, we also have to decide what type of needling intervention we're going to do. And that's very dependent on the person. And then finally, this concept of informed consent and what does that really mean for you and your patients, I think is really important. Informed consent is about having a really honest conversation about all the risks and rewards that can occur deter from any type of a treatment, and presenting other options to the patient that they have to them, presenting all the options that they have. So you and the patient can make a collective choice that it's going to be best for them and their pathology. And so, yeah, these are the things I think we should be talking about. And if you'd like to engage in these discussions about safety and standards of care and patient selection and those sorts of things, I'm happy to talk about that. I really do not want to engage in conversations that are pitting acupuncture versus dry needling against each other. Those are just not productive at this time. And yeah, I again am just really glad that the patient is going to be okay. And I think this is an opportunity really to educate both the professions surrounding needling as well as the public. And yeah, just looking forward to having productive and professional conversations surrounding these things. I hope everyone's having a great evening, and yeah, looking forward to professional and productive conversations. Thanks, everyone.